So I had a patient who I saw on call, and he was absolutely adamant that he would do something for me, give me something, and he wanted to give me chickens. He was a chicken farmer, and he said, "Doc, I really appreciate everything you've done. I'm going to bring you a box of chickens." And no, sir. Please, I'm living in the middle of Houston. I don't have a place to put these chickens. But he was so adamant. I had to convince him that no, I couldn't take his chickens, but he tried so hard to give them to me.
Good morning. Thank you for joining us for Focus Through the Generations. This morning we have Dr. Anna Lehmann, who has joined us, and we're so glad to have you this morning, Anna. Thank you for joining us.
Thanks for having me.
So I'm going to ask if you would just introduce yourself and tell us just a little bit about yourself to get this going.
Sure. So I am Anna Lehmann. I work at Lehmann Eye Center in Nacogdoches, Texas. I graduated from the University of Virginia, then finished medical school and residency training at Baylor College of Medicine in Houston. And since completing residency, I've come full circle, returned to East Texas to join the practice that my dad started 44 years ago.
That's so great. And I had the privilege of knowing your dad and knowing you when you were much younger. Your dad and your mom, and they're great people. And we're going to actually be interviewing your dad later as well. So it's fun to get that both perspectives here. Like, what's it like to work for your dad and what's it like to work for your daughter? But I want to ask you a question. Just want to start off with a little icebreaker here. When you were 12, did you imagine yourself being a doctor or something else?
Oh, definitely. No, I wanted to be a doctor from the start. And really it came down to hands or eyes once I got into medical school and training. I liked the elegant surgeries. There were no rounds. It's a nice lifestyle. I'd watched dad do it my whole life. But I looked for anything else during my training that I might like better than ophthalmology. And my biggest hesitation was the question of whether I could carve out my own place in a field in which my dad was already very well respected. But when I reframed that doubt and saw it more of an opportunity, everything just sort of fell into place.
That is very well put. I love that because there's so many. I think there's a difference. I wanted to ask you this. I see father and sons practicing together, and we've heard from a few of those. And the dynamics, I think, of a daughter and a father are way different than a father and a son working together. I don't think the competitiveness is there. I think more of the nurturing is there. Am I wrong, or do you see that?
No, I can definitely see that. I think my dad and I are a lot more alike than we are different. And that could lead to a lot of butting of heads, but it really doesn't. I think I learn a ton from him, and I've been able to teach him some things too.
I love that. I love that. I really like that. What key skills when you were younger do you think that you developed as you grew that brought you to this place where you are right now?
I think that obviously the surgical skills, the hand-eye coordination, all of that is really important to be a good surgeon. But I think what's more than that is that sense that you need to do your best, that you want to be your best, that every patient is a family member. You should treat everyone like that. And I think that's the more important developmental skill. That's not something that you can teach necessarily. And so I think that being able to connect with people, being able to really care for them and show compassion is what makes you a good doctor.
I agree with you. I love that. That's a beautiful thing to say, and I know that you practice that. Um, what do you think, from your perspective, is the biggest challenge facing ophthalmology today?
I think one of the hardest things is the expectations of patients. I think that as technology develops so rapidly, our patients expect absolute perfection in every single outcome. And I think that's something that most of us are in some way perfectionists. And that's something that's hard to deal with because at the end of the day, you can't be perfect. And so meeting that expectation or figuring out how to communicate with people so that they understand that's not a realistic expectation is something that we're going to have to deal with. I think another thing though is the all of the red tape and EMR and the insurance, and that's something that I certainly didn't fully understand until I got into private practice. But there's a lot behind the scenes that is not just you and the patient in the exam room or you and the patient on the operating table, that has to do with how you're able to practice and what you're able to do.
That's so true. And it's and you still don't get that even today, from what I understand. And when you're going through medical school and your residency and your fellowship, you might get some in your fellowship because they may show you some of the behind the scenes thing. But I think through residency and medical school, that's just not something that you're made aware of. It's all about how to be a doctor or a surgeon, not how to be a business person.
Yeah, that's certainly the focus, and that's their job. Their job is to make you a fantastic doctor. But unfortunately, more and more of what that means is being able to handle the non-medical part of practicing medicine.
Mhm.
I think my training actually, went out of their way to make an effort to teach us some of those things, but it's just not the same until you're in private practice doing it.
It's really difficult too. Yeah. What piece of technology do you like the most that you feel like is something that you couldn't practice without?
I think, I mean, surgically, I think the phaco machines are fantastic.
Mhm.
I mean, they've come such a long way. And when you think about, what my dad trained on, or well, he didn't have phaco when he very first started. I think they've made huge advancements. Um, on the clinical side, I love the OCT machine. I mean, I think what that has been able to do for treating retinal diseases and seeing if there's fluid, leakage that you may not have been able to pick up with the naked eye, or don't have access to an FA or something like that, has really been a game changer for access to care, for people who aren't necessarily able to go see a retina specialist.
Yeah, we've had a lot of people say the OCT. I think those
OCT machine.
I should start keeping track of this because I think it's going to win. We should give it a prize.
Sadly, I'm not getting any kind of compensation for that line.
You didn't mention which one, so that's okay. Um, what do you do in your free time? What do you like to do? What is your non-ophthalmic hobby?
Well, right now it's taking care of my baby. I'm a new mom. I have a 16-month-old, and so my entire non-work time is pretty much devoted to him.
I love that. I love that. I'd love to see that. Um, well, tell me, I know you're early in your career, but tell me about the most memorable, whether it's humorous or whether it's serious, the most memorable patient that you've had so far in your career.
I mean, I had a lady recently, and this is why you get up in the morning and go do cataract surgery, because the post-op day is the best day of the week. Um, so I had a lady recently who, I think she was a minus like 16, and super, super nearsighted, always obviously totally dependent on her glasses or contacts. And we did her cataracts, and she was just thrilled. I mean, she couldn't, for the crying, she couldn't even speak. And it
Aw,
just, those kind of experiences are just very memorable, and just really keep you going.
her life has totally changed. That's crazy. That is so good. I love that. This is the question that we've asked everyone. So I want to ask you this question. And it's going to be so different because you're just coming into practice. So, but I want you to think back like through your medical school residency and then to where you are now. How have you seen technology in ophthalmology transition through your career, and where do you see it going in the next 10 years in ophthalmology?
Yeah, my private practice career is shorter than a lot of the other people you'll be talking to. But if I think back, and even think back to growing up, I think one of the biggest advancements, or maybe it's just that my dad was so excited about it, um,
Mhm.
what is the change in the lenses. The intraocular lenses that we have now are so much better than they used to be. And it's so exciting how it seems like every few years there's a new, better, it doesn't do the things we didn't like. It does the things we wanted it to do, with more reliability and predictability than it did in the past. Um, I think that one of the areas where I'd love to see that continue to drive forward is in our ability to predict which power is best for patients. So the post-refractive patients who, have always wanted that great vision, that's why they had refractive surgery in the first place, they're now in a position where, they're less predictable outcomes because of that post-refractive status. And so I'd love to see these great premium IOLs that work great in their eyes too, with more reliability.
I like that answer. I agree with you. I think that the premium lenses is definitely something that has changed so many lives and just changed our lifestyle so much. And to me, it's been a great advancement as well. Um, what is your favorite book and why?
It's going back to my 16-month-old. We're doing a lot of board books. So right now, Three Little Pigs.
I love it.
Pretty much all I read right now is children's books.
That's all right. That's a good one. That's my favorite too. I like that. I wasn't even sure it was still out there anymore. I want to ask you one question. What is the sweetest, funniest, or strangest thing that a patient has said to you since you've come to work at Lehman Eye Center?
You know, I think really my best story is in residency.
Okay.
I had a patient who I saw on call at the VA, who had a corneal abrasion, gotten something in his eye, scratched his eye in pain. It was, a Saturday afternoon or something. And he was absolutely adamant that he would do something for me, give me something. And he wanted to give me chickens. He was a chicken farmer. And he said, Doc, I really appreciate everything you've done. I'm going to bring you a box of chickens. And no, 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 sir. Please, I'm, you know, I'm living in the middle of Houston. I don't have a place to put these chickens. But he was so adamant. He said, I'm going to just write your name on them and put them in a box and put them up here in this ambulance bay. Is that okay? And I had to convince him that no, I couldn't take his chickens, but he tried so hard to give them to me. But I think it's sweet. Patients are very appreciative of what we do, and they want to be able to make a connection with you and show you their thanks in ways that they know how.
I would have just said, can you just bring me the eggs?
Yeah.
Eggs.
Mm.
Dr. Lehman, thank you so much for being with us this morning. We appreciate you so much for doing this, and I look forward to watching your career grow and hopefully getting back to Nacogdoches to actually see you practice. I would
That
love to.
would be great. That would be great. Thanks for having me.
All right, thank you. You have a good rest of your day.
Thank you.
Bye.